So I used to be really close with my grandmother. She was like my best friend. We had to put her into assisted living to start. So she was going there and she didn't even want to go there. Everything about it. I think the idea of losing her independence, her license, I think they wanted to take away, but we had to because she'd started running red lights. And to convince her to go into there, I said, just try it. And then if you don't like it, I will come and get you out. And she said, you will? And I said, yes. So then she tried it and she ended up loving it. And then when her health sort of deteriorated, nobody in the family really knew what to do. I guess you don't really discuss these sort of things until you're in it. She stayed at my dad's house, and we would take care of her, and she would have sort of a nurse come in and shower her, or every couple of days, or things like that. And then she went from my dad's house to the hospital full time. And it was during COVID, so we you couldn't have her family come in and see her. It could only be two people that were on the list. It was just me and my uncle were the only ones that were allowed to go up and see her. And then she was just heartbroken because the hospitals, they're taking care of one aspect of the person, maybe more, but sort of the physical and the medical side of things. And they don't keep in mind, the mind, the spirit, the body, like sort of all aspects. I think maybe the inclusion of sort of the culture more, especially in like hospital settings. I guess they're trained in a certain way. I think you're taught how to work with people in care, but are they taught culturally how to assist somebody? Like how I would want to be treated, I guess, would be um, everything taken into account. Like you go into the hospital and on the wall and it says can walk to the bathroom with a walker, very independent. There's nothing about personally, and you know what I mean, like likes hot tea, or different things like that, or music even. It's just so, it's not personal, it's not a good personal experience. Everybody gets sort of thrown into it, and then it's financially, you got all the outside things, you got the family and who's going to be supporting, and so maybe more guidance in different resources that would be available in the event of whatever is going to happen. Like I think it should be more discussed. It should be there, everybody's ways should be sort of included, and then go from there. And then your care plan is basically, what if you create your care plan? It's something you should think about, because if you don't, your family and your loved ones have to do it. They're going to have to go through all your things. So you know what I mean? You should talk about it before. A good idea and thing to do would be to sort of find ways to bring the people from different communities together and to discuss it. And I think varying ages would be beneficial. I mean, a lot of times, like people, the elders are teaching the younger children, but the younger children also teach the elders. So, like everybody can learn from everybody by talking about it.